You are watching Access LaPorte County Channel 97. Coming up next is the October 25th meeting of the Michigan City Chamber of Commerce Community Connections event. You can find more information for this meeting at www.accesslaportecounty.org.
Hello, everyone. I'm Amy Newman. I'm the Director of Risk Management and the Patient Safety Officer for Northwest Health, and it's our pleasure to be a sponsor of the Community Connections Luncheon today. As you can probably imagine, today's topic is very important to me and everyone that I work with, and by looking around the room, I can see that I'm not alone. This topic affects all of us, employers, employees, community members, businesses, and I'm looking forward to hearing from our panel. And a couple of them look pretty familiar also. So before we get started, I want to thank the Chamber for their exceptional leadership and for being the foundation of this strong business community. Northwest Health is proud to be a member and partner as we continue toward our goal of building a better and healthier quality of life for the greater Michigan City area and LaPorte County communities. Thank you.
Well, thank you so much for that introduction and that welcome, and thank you again to Northwest Health for sponsoring today's event. Let's give them a round of applause. I would ask at this time that our panelists go ahead and just make their way up to the table up here while I say a few more words. You know, we're gathered here today to discuss a topic of true importance, as Amy mentioned, the health and public safety of our workforce and our community. As responsible employers, it is our duty to create an environment that not only promotes productivity within our companies, but also ensures the well-being of our employees and the safety of the public at large. I want to thank all of you for being here today and sharing in this important topic and being part of the conversation. The success of any organization or business, regardless of its size or its industry, depends on the well-being of its workforce and its commitment to the broader community. During today's discussion, we'll dive into comments and elements that contribute to healthy and safe work environments and ultimately a healthy and safe community in Michigan City and the greater LaPorte County area. So we will begin with introductions, and we can take that mic off the stand so they can pass it back and forth. I don't know if that's gonna hopefully work for you. But we will start with short introductions from each of our panelists so that our audience can get to know who we've invited to join us today. So whoever would like to start, and then we'll cut the date.
Such a gentleman.
Hi, I am Karen Jedrzak. I am the Director of Human Resources for all of our Northwest Health facilities. It's my pleasure to be here today, and I appreciate everyone in this room just being passionate about public health and safety, and appreciate the opportunity.
Thank you.
I am Dr. Christopher Sayers. I am a medical director at Northwest Health Occupational Medicine. Been working with the organization, started out as LaPorte Hospital for just over 18 years here. I'm glad to be here, and hopefully you'll find be somewhat, at least give you some information and answer some good questions for you.
Good afternoon, everybody. I'm Ron Heeg, Sheriff of LaPorte County. I'm in my 27th year at the Sheriff's Office. I'm a lifelong LaPorte Countyan. I'm a Michigan City grad. Well, I'm going to back up a little bit. I'm a Michigan City Rogers grad. I graduated back in 1995, and does everybody, Michigan City residents here, know what they did to us in 1995?
They combined the
schools. They took away our Red Devils and our Raiders, and they transformed us into the Wolves. Now, for the life of me, I can't understand how we come up with the Wolves. I always wonder if it's because of the large wolf population that we have here in So the ideal of the Wolves was not my ideal back then, so please don't hold it against me. So, thank you to Katie and the Chamber for having us here today. Thank you.
So I'm a proud Michigan City alum as well, and I am a wolf because that is the high school record. So we have some other proud wolves in the room. So go Michigan City. Thank you all for being here with us today. We're going to start with a pretty broad question, but when you think about health and safety in the workplace, what comes to mind, and what role do you believe employers play in creating a safe environment in the workplace?
I think it's very important. I was talking a couple with you prior to today's meeting, and 27 years ago, we didn't have some of the issues that we deal with today: workplace violence, school violence, and the Secret Service, back after we started having some of these shootings back and with Columbine and some of these other large-scale shootings of Sandy Hook and everything, they did an intense depth research on what was some of the impetus for this, because we've never seen it before. And 90% or greater of all these shootings, the shooter had an underlying mental health problem. So I think it's very important. And we have, as a society, have done, I'm not going to say the best of job with dealing with some of the mental health stuff. And I don't think it's any one individual fault. We've seen funding for mental health decreased over the many of years. We used to have these large mental health institutions, these state hospitals and stuff like that. And we've slowly seen a lot of those dwindle and decline. And we've given the task of dealing with these mental health back onto our community, but we provided no funding for these issues that are within our own community. So the government said, here you go, you guys deal with it and figure out, and we've not done a good job with that.
It's interesting. We take care of the prison guard population, ISP in Westville, and I was talking to one of our contact people at Westville a bit ago, and about the mental health issues of that. I grew up in Kokomo, and actually I did go through a consultation too. I was a Husky and a Wildcat, so I know what it's like. But it's even worse when you are on the other end of things and you're forced to take your crosstown rivals, mascot name. That's just not fun. But I was talking to him about that because just north of Kokomo is a town called Logansport. They used to have a large mental facility there, and Westville itself was a mental facility until the 1970s. And we were trying to figure out what the, just kind of guesstimate of how much of the people in a place like Westville is primarily a mental health issue, and it's got to be, probably close to half. There's a component, or it could be even more than that. And so, but my other perspective on the question, I usually get, my job as being a treating physician, I usually see things on the flip side. So when I think about, the health, the safety of that, I look at things like, people in facilities, what can you do to foster people being healthy? And what I see is, trip hazards, that kind of stuff. So a lot of the things that I see are, you just be careful of the environments and what have you, because there's a lot of things that, like in retrospect, that they look at like, yeah, maybe we shouldn't have put all these boxes in that corner there, with that. And so somewhat that go back to the mental health, that does play into it also. That when the employees are healthy and well and treated well, they tend to be more resilient and less of an issue, because when they come in my office, I hear all the nuts and bolts about what's going on. Usually the things that are not, that people don't like, and there are a couple of recurrent themes. One is treating people well. Pays dividends all the way around, and the other things be careful about, just the environment, lighting, trip hazards, cords. That's I see that quite a bit. Of course, now we're getting to pretty soon. I will not say the word, but that white stuff coming down. Slip and fall season is always something to be in. When you look at on the employer's end of that, not so much me, I'm the inexpensive one, but when you get things that go to like the orthopedic surgeon, need that kind of stuff, that's when workers' comp gets really expensive.
And I am representing the employer side as well from a human resources perspective and employee health perspective. We work closely with Dr. Sayers and his team. Often it's also the environment, but we've seen a lot of dependency issues after COVID and for our team members, and being able to support them in their journey and help get them the resources that they may need. Also being able to expand our benefits. So, public health and safety, taking care of patients, but taking care of our employees first and foremost to ensure that we're able to take care of those patients. So whether that be mental, emotional, physical, safety, that's what I look at for all of our team members, and train for our managers too. Recognize signs, recognize when someone is acting out of their norm, or maybe they're calling off routinely, to be able to say, something's not right with you, are you okay? And opening that door. And oftentimes, they'll say, actually I'm not, or they'll say, I am, but they'll come back later and say, thank you for asking, I'm going through a hard time. And just opening that door and having that conversation can help save someone's life. I've seen it time and time again. So that's my role.
Yeah, so if you could hold on to that microphone, I kind of expand on the next question that I was going to ask is employee burnout and stress and turnover rates. I think it's something that all employers really face and have concern about. So you talked a little bit like what are those signs? Maybe elaborate on a little bit more. And then especially for employers who don't have an HR department and don't have maybe that expertise in-house, what is a step that they could maybe take to make sure, to ensure that their employees are doing okay and that retention rate is there?
Sure. Burnout is very real in every industry, right? We've just come through a pandemic that we never imagined that we would ever experience. At least I hope that's how everybody else feels. And so, we're a challenge, like what does life look like afterwards? And, what are the issues? There's learning loss in schools, there's dependency issues with adults, there's, financial constraints. And so there's a lot of burnout and extra concerns that people are carrying with them. And so, I think we're all people, right? And so just opening the door and asking the questions when you see the signs, when you see that someone is calling off and that's not normal for them, or, maybe they're, not talking as much, or not interacting with the individuals that they usually interact with. Sometimes it's just physical signs too, where you're looking, okay, someone's lost a lot of weight, or they've gained a lot of weight, or their eyes are, sunken in. It's really looking at their physical appearance and then their mannerisms, just to open that door and have that conversation. And I encourage that from our managers, because HR is there to support and we can give tools and resources, but it starts with the people that they work with immediately. And we hear a lot, well, I didn't want to tell on someone, or, I didn't want to tattle. It's not tattling, you're impacting their life.
Yeah. And maybe even some policies that might be in place that managers can then reflect back on, and especially starting from the onboarding process of a new employee, setting that culture for this being a safe and environment to work in.
Absolutely, and it goes further than just the person, but also well-being from the standpoint of, our society has a tendency for violence, for substance abuse. If you look at studies for public health and safety, those are the top items that we're dealing with. And so whether it be the employees or the employees having to experience it with the customers or with the patients, regardless of what industry you're in, you get those, I call them dipsy-doo stinkeroos, the people that are, maybe not having the best day and are aggressive, how to deal with that. So training also in de-escalation, or training in active shooter, and doing drills and being prepared for the worst so that you can hopefully handle it the best.
Yeah. So maybe if you want to pass the mic to Browning there, Sheriff, kind of leads into my next question. You guys are really just moving right along these questions. Really, you're really good. So, sometimes even when you are having concerns and you are taking and addressing all of those issues that might pop up with employees, there are times when unexpected situations can arise within a workplace. How do employers prepare for those, and how does that preparation play into the community when there's an emergency situation or a violent situation that escalates?
Sure, and that's a good topic to discuss, because we as police officers are very type A personality, and we don't like to discuss our mental health with anybody. A police officer, they say throughout a police officer's career will experience 800 true traumatic events in their lifespan. A normal American will only experience 2. So when an officer experiences a lot of that stuff, it gets put into the memory bank, right? And police officers just deal with the situation and go on to the next one and go on to the next one and go on to the next one, right? As you as a normal citizen, you have that true traumatic event in your life, and you've got time to recover from it. Whether you take a couple days off of work because you had the loss of a loved one, or something bad happened to you, that, a family member got diagnosed with cancer. When I mean true traumatic events in life, I mean just that, a loss of a loved one or something like that. Your spouse or a child was killed in a car crash. Those are true traumatic events in a life. Losing your debit card or misplacing your keys, although you may be late for work, is not a true traumatic event. And our officers see this on an everyday basis. And I was talking to a couple of you before that as we were going into COVID in 2020, not just here in LaPorte County, but nationwide, the suicide rate skyrocketed. And it was out of control. People were confined in their homes. They were scared. They didn't know what was happening. They were seeing on the news of all this death and ill and sickness coming out of China. It had people really worried and concerned. And I was telling Bill that my own mother was fell into that. She had locked herself in the house for a month. Wouldn't let me or my brothers come into the house because she was so afraid. And I finally said, enough of this, let's go. And got her out and broke her out of that cycle. It's very easy to get caught up in that cycle. So we do have some practices or policies in place at the Sheriff's Office. We do contract with a mental health provider that our officers at any given time, day or night, can reach out to the doctor. We have a line item in our budget that pays for that the officer doesn't have to worry about funding or anything like that. All they got to do is call, make an appointment, and go anytime, day or night. So I like to back up a little bit. Just keep an eye on your employees and just make sure you work with these individuals for quite some time. You know their normal daily habits. You know how they are. And you start seeing stuff that comes out of play and out of the norm. Usually something's going there. We all have our gloomy days, where we're just not in the best of mood, whether we didn't get enough sleep, we were in an argument with our spouse the night before, or whatever. We're all going to have those days. But if it persists for, some given time, and you really start seeing some noticeable difference, whether weight loss or anything like that, it probably could reach out and ask them if everything's okay and really be persistent. So,
I'm just passing on if anybody want to expand on that, Dr. Sayers, at all?
I mean, yeah, not necessarily just I think a lot of it is when I see in my clinic is just, we see people coming in here, and I'll even talk to the patients a little bit. I have a tendency to get chatty with them occasionally, but, how are things going with you, and that. Sometimes they'll open up to me with that kind of stuff. And I know a lot of times that, we're the physicians and health, or healthcare professionals are supposed to be, kind of the front line where they can. And one thing I get too is that the people that are like physicians, they're hurried too. They don't have a lot of time to do so. So if I have a chance to talk with them, they can come in and make an impact. That just goes along with the people that I work with also. We have huddles and that kind of stuff that we didn't have before, and that's made an impact with that. But yeah, just, getting there, talking to people, eventually they'll open up to you. Or maybe it'll spur them to open up to somebody else who can help them out on to do what they need to do.
Yeah, so let's move on to maybe thinking about the broader community and the roles that especially a hospital plays in our community, in the county, that the Sheriff's Department plays in making sure that our community is safe and healthy. Maybe talk a little bit about any specific programs that you guys are doing at Northwest Health that is more of an outreach, or even same with you, Sheriff Heath.
So for us, being a community hospital, we have programs for our internal employees, but we also have programs that we reach out and we try to be good community partners. And so it may be, dealing with the disease process and helping give information so that our providers, and we have open talks from providers for dealing with the disease process. We also do support groups, and I think those are incredibly important. And we have to stop the stigma of individuals not being willing to share their stories. No one should ever be scared to share their story of a miscarriage. Nobody should ever be scared to share their story of having cancer or losing a loved one or having a dependency issue. And so I think that is one of the barriers that we are trying to support by whether it be a diagnosis or a treatment or something that you just didn't expect, that we're able to support the community and support our patients through that. And I would like to say to the sheriff's department that when we had a tragedy in the emergency room a couple weeks ago, you also have a social worker who is amazing. Yeah, we better. It was fabulous to be able to work with the city and the county police and be able to have their support services, not just for their team, but also for the family and for the hospital. So I think that's a really important line item that you guys have added, that, you know, from a city and a county perspective, that is critical for our community.
Yeah, we'll have outreach programs too, but you're talking about, you know, just kind of emergency thing. You know, the hospital tends to be the hub of where it is. You know, the emergency room will take care of, you know, population, first responders and everything that needs to do that. But I think some of it goes back to, you know, preventing. You know, we'll have there's the wellness programs that we have to kind of, you know, keep these things. We'll go to companies, and one of the things that we do is a lot of it go and do drug screens for that. You know, try to keep as much as you can, which is more difficult nowadays, especially with the legalization of marijuana in the states around us. You know, drug-free workplaces. You know, I'm a firm believer in that, and you tend to have, you know, much lower rates of injuries, and I think, you know, I think things will come out a little more so that you know, the impact on mental health with drug use, even you know, the legal ones, is, I think there's going to be a lot more of that'll come out as time goes on, as you start seeing the after effects of more and more people using these substances.
I don't have a whole lot to add to it, but I think just creating these partnerships that we have here, you know, prior to my tenure as sheriff, we were never part of the Michigan City Chamber of Commerce, and we've started that. We've started some partnerships with some of these other groups throughout our county, and create these partnerships and create this open dialogue and talk and know what services are out there and how to refer, where do we go, and how are we going to do this, and why are we do something a certain way really helps with that. So just creating those good community partnerships, because we all live in this community together. You know, I don't drive in from anywhere else other than here in LaPorte County. You know, my wife works here and St. Franciscan Health.
She's a wonderful person, so I'll accept it.
You know, she works here in the community. Our girls go to school in this community. We shop in this community. You know, everybody thinks that as police officers, we just want to lock people up, take you to jail, and write tickets and stuff like that. But that's not true. We do care about our community. We're very passionate about it. And, you know, the last thing that any police officer wants to have happen is somebody be a victim of crime on their watch. You know, when I worked patrol many years ago, we'd have something going like, hey, damn, how did I miss that? Or how'd they get that past me? How dare you, you know? And it just, because you have that passion and that sense for your community.
So continuing along that kind of topic, like looking at the most pressing issues that we're facing right now with public safety. Obviously, we spent a good couple of years focused on COVID, and we're past that now, but it doesn't mean that something isn't on the horizon that could take up our time and occupy our time. But what right now would you say is the most pressing issue in LaPorte County around public safety, and how are those being addressed?
Drugs and mental health, those are the two biggest things. And when I say drugs, it's not your marijuana that we see. You know, the doctor talked about it, how all the states around us have legalized it. Indiana is such a conservative state. We're probably going to be one of the last states of the union to legalize marijuana. I'm not going to get into my personal stance with it, but you know, 27 years ago when I started the sheriff's office, the major issue that was affecting society was alcohol and marijuana. You know, we took a really aggressive stance on the marijuana, and we've got individuals locked up in prison today with it. And now we're legalizing it, right? Today's drug of choice is the fentanyl and the heroin, and we know how deadly that is. And the mental health aspect is a second cause of that. And we see at the sheriff's office and in the county jail, the doctor talked about it, about 50% of the people in the county jail right now have some type of mental health issue. And those individuals in the jail won't seek professional help. They think they can't afford it, or they're just too afraid to. So they do what we call self-medicate. They'll go out and get this heroin, this fentanyl, and some of this other stuff. And we see it especially with a lot of younger women who were sexually, mentally, and physically abused as a child and grown up, that they'll self-medicate themselves and get hooked on it. And so I think those are the two biggest issues that I see at the sheriff's office.
I don't have much to add with that. I agree with that. Again, that's we see that quite a bit. One of the things that I do is I'm a medical review officer, so I review drug screens. And a lot of times they're coming in for like a pre-employment drug screen. Now, mind you, most of these substances, they flush out of your system in a couple days. Marijuana being the other one. And the amount of multiple substances coming in on somebody who basically knows they're going to be going for for an interview and probably doing that. It's just it's amazing how much more that polysubstance abuse is nowadays versus before. It's keeping me busy, but it's just amazing.
We hear of drug screenings from employers as being one of the biggest barriers to being able to recruit and hire. And, we've heard from employers that have decided to not test for certain drugs on those screens. Do you see some of that changing? How have those screens changed maybe in the last few years as demand for workforce increases?
The biggest thing I see is either ignoring or taking marijuana out of the panel, which can be doing. And you talk to them, it's like we can't find anybody or keep anybody. So, and eventually the word gets out to which companies that have that, even though they will not do that. Otherwise, there's been changes in some of them, adding some of more of the like ecstasy and that in there, some of the more designer type of things on there, adding them to those panels. And it's always a game of cat and mouse with those. Bath salts was a thing that was popular a number of days ago, and we got a lot of calls about can we add that to the panel? But as soon as you do that, it changes. There's the standard ones that have been around forever and readily available that you'll see from time to time. But there's plenty of stuff out there you can read about that might not be out here yet, but it'll get here, and then by the time it's just they're pretty. Those folks are pretty quick on their toes as far as going from one thing to another. It's hard to catch and hard to maintain. But the biggest thing I see is a lot of the significant amount of the employers have taken marijuana out of the panels. They're not even testing it. Some of them are testing, and they don't. They just will ignore. Go ahead.
You add to any of that, or
No.
I
think we covered it.
So we've talked a lot about mental health and stress-related issues in the workplace, and just any additional comments that you would have, and then we'll open it up for some question and answer from the audience around addressing those concerns or finding different resources within the community to prevent some of those.
I would say that would be the thing that we need to continue to expand upon is the resources and giving resources to our community. What are the resources? We partner a lot with Swanson Center and Porter Stark Services and Dudebrook. We try the Healthcare Foundation. We try to think of different ways to support our community and our patients, but we have a gap. We identify that gap when we're seeing patients in the ED that are being treated for mental health. But we do have to honor where they are in their journey. I think that's the hard part is we can know the resources, but what's the number of individuals who will take those resources? But there's still limited resources in behavioral health specifically.
Yeah. So maybe one more question before we open it up to Q&A. We're all community members of this county. Some of us might be employers, some of us might be employees within the companies that we work in or the organization that we work in. But we all, as community members, play a part, especially when it comes to mental health and public safety. And I think it's important that you figure out what is that role that you play as a community member of this county. whether that's within your company or your organization, or that's attending a meeting like today to be better educated, or attending a city council meeting or a county council meeting about these topics and how do we produce more resources. But if you were to give one piece of advice to everyone here today, what would be one thing that you would say to them to just be more aware and be more educated about health and public safety in our county?
Just be involved. Being here today shows that you're obviously involved and you want to be here and that you do care and take an active role. Too many people will say, just turn a blind eye to it, or say, you know what, that sounds like a great idea, why don't you do it? How about you help out and let's work together and let's not have a battle of, the sheriff's office or the police versus the community, or health versus, this. Let's work together and let's not butt heads, and I think that's just it. Good cooperation and communication, and let's work together.
I think mine being from a medical viewpoint, learn CPR. Something's going to happen to some people sometime. And they've changed. It doesn't take much to get certified, or even if you don't get certified, you can find a YouTube video of that. Because eventually, the odds are you're going to come across something. You said twice in your life, you're going to have some kind of experience, and you got to, knowing what to do. Know the 911, or hey, if you're at a sporting event, where's the AEDs? We've had some some organizations here that have done fantastic work about making sure AEDs are more accessible. Hey, how do you use them? Well, you don't want to know that when you have somebody, potentially a loved one, in front of you when you have that. So think about it a little bit now. You could save a life later.
Can I just, since this goes with exactly what you said, 2 weeks ago, I took a class, a CPR class, over at LaPorte Fire Station, and LaPorte County Foundation offered it for free. And so I think they're the only ones that you can take this class for free. And I'll tell you what, I learned, it was great. It was empowering to know these things, and I applaud it, and I applaud the LaPorte County Foundation because they are supplying AEDs all over LaPorte and in the schools, and I just think we need to applaud them. And again, CPR, it was 2 to 3 hours of my day that I learned. They actually made me stay extra because I wasn't compressing hard enough. I didn't care. If anybody needs it, I'm here for you.
Awesome. Well, kudos to you for getting that done. That's awesome.
It is, and it's a great offering, the Healthcare Foundation, and back to just partnership, being able to identify what the needs are. And if we know what the needs are, Healthcare Foundation has been very supportive in identifying, okay, how do we get that done? And so in the case of the fire department wanting to offer free CPR classes, and they, volunteer their time to do that on, weekends and days for community members, because they respond also to those traumas, and they have to take that home with them. So if we can save somebody by having properly trained, but also if you see something, say something, and let's partner and figure out how to solve it for our community.
Thank you. I think any other additional questions from the audience or comments? Yes.
I have a question. I wanted to ask about, and I'm going to mispronounce it, I hope I don't. What is it, naloxone or overdose?
Narcan.
Narcan, thank you, Narcan. I wanted to ask, that was really big about 2 or 3 years ago, and there was a big push to get citizens to take a course and carry it. Aside from emergency services and medical settings, are there any other organizations that are currently, or maybe we should be thinking forward, should be resources for this substance? I mean, because I don't know if it's.
I think there's communities that actually have vending machines where you can get.
Yeah, I was just going to say, trying to think, probably about 4 or 5 years ago when this all started becoming a huge issue with the heroin epidemic, the sheriff's office, then Sheriff Boyd, tasked me with creating our Narcan program. We were one of the first in the state of our officers carrying Narcan, and we had partnered with LaPorte Hospital at that time, who provided it to us. And then it obviously the nationwide epidemic grew and grew and grew. And now individuals, you can go into CVS and Walgreens and get it. And like I said, now there's vending machines that you can just go and get this Narcan.
May I follow up?
Yeah.
So would this be something that you would encourage any and all LaPorte County citizens who have an interest in carrying this life?
Like, should we all be carrying it?
I think that's a matter of personal choice. I'm not going to tell you that you should. I know that using the Narcan injectors it's very simple and very easy. I mean, I could teach you to do in about 5 seconds, and that's how simple it is. So I think that is just a matter of personal choice. Now, do we have a lot of individuals falling out, walking down the street of a heroin overdose, like we would like a heart attack or something? No, you're usually doing it at home in the privacy of their own home, and a loved one or somebody will find them overdosing or unconscious. So.
Good question. Any other questions or comments? Yes.
So in terms of, you talked a little bit about partnerships and the pandemic. What are some of the lessons that you learned in terms of coordinating these huge messages that come from the federal to the state to the county to hospitals and sheriff's office to get that consistent messaging to individuals?
Again, I think it starts like right now, and it starts prior to all that, creating these partnerships, creating these communication routes and everything else where we can all kind of be on the same page. We do see a lot of stuff come down from the federal government. Part of the problem is that the federal government will come in and tell us what we need to do, but they don't want to provide us any funding to make it happen, and that's one of the biggest issues that we see in these locally, the feds, they can just print money, and we see that happen a lot, Here, we're bound by our budgets, they're going to come in and tell us, you've got this much money, and you got to figure out how to make it happen. And that's the biggest stuff. The biggest challenges we see at the sheriff's office is just that funding for stuff. We would all like to have these new gadgets and these new crime fighting tools that will help us solve crimes. Who's going to pay for it? And not only is the initial equipment very expensive, now you have ongoing reoccurring costs to pay for the maintenance, the licensing fees, and everything as well. And that's the biggest challenge as well. Yeah, this might be a good tool, but how are we going to sustain that cost in the long run to pay for some of that? Some of the licensing and the maintenance fees are more expensive than the actual piece of equipment itself. So it's just a never-ending challenge, And then you got to also think: is this just going to be a fad, or is this something that's actually going to sustain in the long run and be very useful in the future?
One of the things that I found was, especially when the pandemic, again, we're starting from a basically zero knowledge base to, pandemic in about 3.2 seconds. And, you'd have different guidelines coming down. And part of this, is trying to, be able to synthesize and see if there's any, and occasionally you'll have discrepancies in them. And then you just got to keep up with it, because then they'll change. And sometimes it's good. You'll find, you'll get an email from the Board of Health, State Board of Health that'll do that. So it's just constant learning when, in that, as this, because everything's just in flux, kind of makes it difficult when you have, a lot of different, usually the CDC is the main governing body when you're looking at a lot of that. But if you ever read some of their guidelines, it's like reading technical manuals trying to hook up a stereo or something like that. So, a lot of it, you got to try to, sometimes you got to try to figure out, what is the most current, where it is, because sometimes if you start looking it up, their site might not be, updated too. So it just takes a lot of, it's just, it's constant attention to try to figure out, okay, where are the best practices right now, and are we living up to them, or, and just keep an eye on when are they going to change next.
Yeah, and there's just a lot of trial and error too. You just hope you make the right decision, and and if not, you adapt, improvise, and maybe you make a change and you look at a different option. So.
Greg, did you have a question?
Well, throughout the talk, we were talking about how prevalent the mental health is an issue, and I don't know if there was any plans of increasing resources for that within Northwest Health, or other than obviously the setting up a home counseling session, or is that?
Yes, there are many discussions occurring throughout lots of different community resources and different hospital associations as well. I think that it goes back to the funding and pay it is very expensive. And so one of the barriers is, whether it's inpatient or outpatient settings, to provide that support, we don't really have a lot of coverage from a perspective. When I say we, us as individuals, if you go and you look up your insurance coverage for somebody that has an issue, it's usually pretty poor from a coverage perspective. I think that's the biggest gap from a healthcare provider and services and an individual that needs treatment. If you really want treatment, how am I going to pay for it? It is definitely a gap. We did have a conversation with the Healthcare Foundation that we'll continue to pursue as to what are our resources, what are the gaps, and how can we help support the community.
Yeah. I recently had the opportunity to attend the most recent Sinai Forum put on by Purdue Northwest. Their speaker was Dr. Bruce Perry, or a couple people in the room that were with me for that event, and I had not read, he spoke specifically about a book called What Happened to You, and it was kind of flipping the conversation and the question of not what's wrong with you as an individual because you're acting out or you're taking drugs or you're depressed or whatever, but what happened to you? And it often comes back to those traumatic experiences like you talked about earlier, and even traumatic experiences that can happen as early as an infant that you don't even recall can have an impact on your entire life. So since then I'm like one chapter away from finishing the book, and I feel like it's a book that everyone should read. So write it down. What Happened to You, Dr. Bruce Perry. But specifically, he talked about, even in that speech at Sinai Forum, he gave some staggering numbers, which I'm not going to recall at this moment, but there's not enough healthcare professionals in our country, let alone in smaller communities, to address the needs of those who are experiencing mental health issues. It's a crisis. Very similar to the numbers when we look at childcare. And there's just not enough childcare workers to actually fill and create the spaces for the number of children that need to be in a childcare setting that's productive and quality and what it should be. And so those answers are really hard and to give, and also to have those questions given to you. But I think it boils down to, you have to really start to look at some long-term solutions and then advocate for them. And whether that's on a local level or a state level or a federal level, reaching out to your elected officials and having these conversations with them. How do these issues impact you as an employer? Bringing those issues to us at the chamber so that we can have a collective conversation about what are some of those solutions, making sure that they're looking for solutions. Because even though they hear the problems and we talk about the problems, are we looking for funding mechanisms, which often have to come from state or federal funds, in advocating for those. So it's really, the conversation has been great today, and I really appreciate it. We are closing up here at the last couple minutes. I would just ask each of you if you have a closing comment you'd like to make before we depart for the day.
One last plug. I would say, because you mentioned that book, is that everyone should be able to acknowledge at some point we've had a traumatic event, sometimes two or more, and therapy is real. Being able to make sure, look into your resources. We've expanded our benefits to have telehealth therapy, and sometimes it even includes financial counseling. So because a lot of money problems lead to some of those other issues. And so see what's out there for you and your family on your coverage plan, or as an employer on your coverage plan, and expand that therapy part and encourage people to take advantage of it, because that will help for the long term as to, helping people deal with what occurred in their life. And maybe it isn't that traumatic, but it's traumatic to them, that they will be able to avoid some of the things in the future that we're experiencing.
Yes. Yes.
So oftentimes, and this is super important, that everyone when they have an opportunity to share their sad story. Don't have sad story competition anymore.
Just listen. Yeah. Good point.
And that has been a problem. Is oftentimes people want to come to you with their issue, and you want to have sad story coming.
That is a good point.
That
Yeah.
at that time because it took them a long time to come to.
Yeah. Listening is such a key component. Very well. Yes. Thank you.
I would just say be active in in the community, and it could be just as easy as listening to somebody because you might be the first person or the one person that would do that today. That kind of keeps a person. Hey, maybe I'll stick around for another day and do the work. But it's not always a big thing that we do that can make an impact. It's just little things that we do every day. Can make a big impact on, or even if it's a small impact, if that's what you need, then that's the small impacts can add up.
Before I close off, Fonda, did you have a question? I thought you had a question. You raised your hand there and Katie kind of touched it.
Oh, sorry. I didn't see your hand.
Super good. Yeah.
She was seen today.
Well, we see a lot of people, or maybe not a lot is the right word, I don't know, but, we work in a public building at the library, which I think people don't think of the library that way often, but we are a public building, we welcome people, all people. So, but we see some folks who seem to be caught in loops between emergency style healthcare and law enforcement. It's like they switch, they're in the ER and then they're in jail. They're in the ER and then they're in jail. So, I'm surely, it's making an assumption on my part that is stressful for that person. But it's also stressful for people who have to observe that. And so I wondered if you had specifically any tips for how to deal with seeing repeat situations in which you feel like you can't impact what's happening.
Yeah.
That's a particular kind of stress for staff.
Yeah, it's I wish there was an easy answer for that, but there is no easy answer. We talked about the lack of mental health facilities that we have, not only here, but nationwide, and the lack of not just the facilities, but the staff to support it. My wife in the healthcare industry, had said that Franciscan has been trying to bring mental health doctors in to come here, but they don't want to come to Michigan City. They would rather go to Chicago, they would rather go to New York, they'd rather go to LA, live in the bigger cities and make the money. So that's what we see here. These individuals, you're absolutely correct. And part of the problem is these individuals have no family because their family has given up on them or doesn't want to be actively involved. We've got individuals in our jail who have no business being in jail. Jail is the last place for them. But they go and they commit these, what I'm going to call petty offenses, whether it's stealing a candy bar or knocking over a gallon of milk and causing some a disturbance in the store so they get locked up. Well, that's good news for their family because their family now knows that they're one safe and that they're being fed and that they're being treated properly in the county jail. So they leave them there. But you can only keep them there for so long because then their case runs through the system, and then we just do the cycle over and over and over, unfortunately. So what you bring up is, I think, is a huge problem. I wish there was an easy answer for you, but unfortunately I don't have that for you. Just in closing, mental health is real. Don't be afraid of it. Don't let that stigma bother you about that. Seek the help. There's help out there. We mentioned a few, our hospital systems. We have Swanson Center, Porter Stark, and if I leave anybody out, I apologize. It's not intentional. One of the last groups I spoke to on mental health, I inadvertently left an organization out, and what did I hear about it? So it's not trying to cause problems, but there are facilities here in LaPorte County that are out there. Don't be afraid to reach out.
Thank you. Thank you again to all three of you for joining us today. Let's give them a round of applause.
Thank you again to Northwest Health for being our sponsor today. This is our last Community Connections Luncheon for 2023. This was a kind of a pilot year for these luncheons, these quarterly luncheons this year. They definitely are something that we want to continue and will continue into 2024. So we hope to finalize those dates soon, but expect to see them once a quarter in 2024 around the similar topics. We'll have different speakers. We'll focus on different areas within those topics. So be on the lookout for that information. Follow our weekly newsletter that comes out every Thursday morning. Follow us on Facebook to get all of our updates on events. And again, just thank you for being here and thank you for being part of the conversation. I'm going to leave you with 2 words. Listen, I like that, and smile. Thank you.